Good morning all. Today's topic is arches of foot. The foot has to act as a pliable platform to support the body weight in the upright posture, as a lever to propel the body forward in walking, running or jumping. To meet these requirements, the human foot is designed in the form of elastic arches or springs. These arches are segmented so that they can best sustain the stress of weight. The presence of the arches makes the sole concave. This is best appreciated by examining footprints which show the weight bearing parts of the sole. In this diagram we can see footprint showing the weight bearing points of the sole. An arched foot is a distinctive feature of man. It distinguishes him from other primates. The arches are present right from birth, although they are masked in infants by the excessive amount of fat in their soles. Classification of arches: longitudinal and transverse. Medial longitudinal arch, lateral longitudinal arch, anterior transverse arch and posterior transverse arch. Formation of arches. Medial longitudinal arch. This arch is considerably higher, more mobile and resilient than the lateral. Ends anterior end formed by head of first, second and third metatarsal. The phalanges do not take part in forming the arches. And the posterior end of this arch is formed by medial tubercle of calcaneum. In this diagram we can see ends of medial longitudinal arch. Summit of this arch formed by superior articular surface body of talus. Pillars: anterior pillar which is long and weak formed by talus, navicular, cuneiform and first three metatarsal bones. The posterior pillar is short and strong and formed by medial part of the calcaneum. The main joint of the arch is talocalcaneo-navicular joint. Lateral longitudinal arch. This arch is low, has limited mobility and is built to transmit weight and thrust to the ground, in contrast to the medial longitudinal arch which acts as a shock absorber. Ends: the anterior end formed by head of fourth and fifth metatarsal bones. Posterior end formed by lateral tubercle of calcaneum. The summit lies at the level of the articular facet on the superior surface of calcaneum at the level of subtalar joint. Pillars: anterior pillar long and weak, it is formed by cuboid bone, fourth and fifth metatarsal. The posterior pillar short and strong, it is formed by lateral half of calcaneum. The main joint of the arch is calcano-cuboid joint. In this diagram we can see bones forming the lateral longitudinal arch of foot. Transverse arches. Anterior transverse arch formed by heads of 5 metatarsal bones. It is complete because the heads of the first and fifth metatarsal both come in contact with the ground and form the two ends of the arch. Posterior transverse arch formed by greater part of the tarsus and metatarsal. It is incomplete because only the lateral end comes in contact with the ground, the arch forming a half dome which is completed by similar half dome in the opposite side, opposite foot. In the diagram B, in this diagram we can see posterior transverse arch of foot. Half domo posterior transverse arch also completed when the two foot are close together. Factors responsible for maintenance of arches. Number 1 factor is shape of bone. Number 2, intersegmental tie or ligament and muscles that hold the different segments of the arch together. Number 3, tie beams or bowstrings that connect the two ends of the arch. And number 4, slings that keep the summit of the arch pulled up. Shape of bone, intersegmental tie, tie beam, slings. Shape of bone, intersegmental tie, tie beam and sling. Bony factor, the posterior transverse arch is formed and maintained mainly because of the fact that many of the tarsal bones involved, the cuneiform bones and the head of metatarsal bones are wedge-shaped, the apex of wedge pointing downwards. Intersegmental tie, all arches are supported by the ligaments uniting the bone concerned. The spring ligament for medial longitudinal arch, the long and short plantar ligaments for the lateral longitudinal arch. In case of transverse arch, the metatarsal bones are held together by the interosseous muscles. Tie beam. The longitudinal arch are prevented from flattening by the plantar aponeurosis. This is plantar aponeurosis. And by the muscles of first layer of sole. These structures keep the anterior and posterior ends of these arches put together. In the case of transverse arch, the adductor hallucis act as tie beam. Slings. The summit of the medial longitudinal arch is pulled upward by tendon passing from the posterior compartment of the leg into the sole. Example, tibialis posterior, flexor hallucis longus and flexor digitorum longus. The summit of lateral longitudinal arch is pulled upward by peroneus longus and peroneus brevis. The tendon of tibialis anterior and peroneus longus together form a sling which keep the middle of the foot pulled upward, thus supporting the longitudinal arch. As the tendon of peroneus longus runs transversely across the sole, it pulls the medial and lateral margin of sole close together, thus maintaining the transverse arches. The transverse arch is also supported by tibialis posterior, which grip many of the bones of the sole through its slips. In this diagram, we can see this is plantar aponeurosis. This is medial tubercular calcaneum. Plantar aponeurosis. Flexor digitorum brevis. Flexor hallucis longus and digitorum longus. Abductor hallucis and flexor digitorum longus. Flexor accessorius, lumbricus, short plantar ligament, long and short plantar ligament, calcaneonavicular ligament, peroneus longus and long plantar ligament, interosseous muscles, peroneus longus. Functions of arches. The arches of foot distribute body weight to the weight-bearing areas of the sole, mainly the heel and the toes. Out of the latter, weight is borne mainly on the first and fifth toes. The arches act as spring, chiefly the medial longitudinal arch, which are of great help in walking and running. They also act as shock absorber. The concavity of arches protect the soft tissues of the sole against pressure. The character of medial longitudinal arch is resiliency and that of lateral longitudinal arch is rigidity. Clinical anatomy. Absence or collapse of the arches lead to flat foot, pars planus, which may be congenital or acquired. The effects of flat foot are as follows. Number 1, loss of spring in the foot lead to a clumsy shuffling gait. Loss of shock absorbing function makes the foot more liable to trauma and osteoarthritis. Loss of concavity of the sole leads to compression of the nerves and vessels of the sole. Compression of the communication between the lateral and medial plantar nerves causes neuralgic pain in the forefoot. Compression of blood vessels may cause vascular disturbance in the toes. In this photograph, we can see flat foot and footprints of flat foot, pars cavus, and normal foot. Pars cavus. Exaggeration of the longitudinal arches of foot is known as pars cavus. This is usually a result of contracture plantar flexion at the transverse joint, where dorsiflexion of metatarsophalangeal joint and plantar flexion of interphalangeal joint due to atrophy of lumbrical and interossei are superadded. The condition is known as clawfoot. The common causes of pars cavus and clawfoot are spina bifida and poliomyelitis. Talipes equinus, in which the patient walks on toes with the heel raised. Talipes calcaneus, in which the patient walks on heel with the forefoot raised. Talipes varus, in which patient walks on the outer border of foot, which is inverted and adducted. Talipes vulgus, in which patient walks on inner border of foot, which is everted and abducted. Clubfoot, Talipes equinovarus. Foot is inverted, adductor and plantar flex, associated with spina bifida. Two types, Talipes calcaneovulgus. Foot is dorsiflex at ankle joint, everted at mid-tarsal joint. Talipes equinovarus. Foot is plantar flex at ankle joint and inverted at mid-tarsal joint. So this is all about arches of foot. Thank you.